what excites you about TMS, first of all?
It's just such an effective modality. One of the first people that I treated was someone who had been in treatment with me for years and had failed to respond to multiple medications, multiple combinations of medications. People come to me because they've failed to respond to the first thing that their, primary care doc has put them on or somebody else. And we're good at getting responses, but we end up layering atypical antipsychotics and, so on and so forth. We give people a high side effect burden. But this particular patient, after years of not responding to everything in spite of side effects, and she was a trooper, did everything that I asked of her. And she knew all the other things that she needed to be doing for herself, working out and eating right and everything else.
Okay.
But she had a high-powered job and she had a complex situation at home, and she just couldn't do the additional things. After she worked, came home, she was just spent. And the PHQ-9, the scale that helps us to determine the level of severity, was off the charts. And had been for years. She was incredibly stoic. And she was one of my first TMS patients, and her PHQ-9 went from over 20, which is a very severe depression, to 0.
How long?
It was the standard protocol, so 36 sessions, and by session 20, 25, somewhere in there, she'd started to show a pretty robust response. I was stunned. I brought in TMS to help this kind of patient, and that was just an amazing response.
That's exactly what we're looking for with this, right?
That's right. And not everybody gets that great a response, but we found, especially for these patients who are, treatment resistant, that we're getting 70, 80% response rates where medications and multiple med trials, multiple layering of medications, that we're able to get amazing results for them.
So in practicing medicine over 20 years, have you found anything else that would produce that kind of response?
No. For this patient population, it is amazing. And my frustrations, is that people still don't know about it. And the insurance companies are, limiting the availability that they'll pay for people who failed a lot of medications and have very severe depressions. And there's an underserved population of folks who either don't want to try medications. The side effects of meds, you get tired, you lose your libido, you gain weight. People don't want to put up with that necessarily. Then the insurance companies don't want to pay for that. It's been pricey. Right? We've tried to bring down the price in our own clinic to make it more affordable, but it's still something that people hesitate to pull the trigger on, even though they can get such a remarkable result over a period of time. With the accelerated protocols, 6 days, we can get a response, and it's sustained. So Stanford came out with an accelerated protocol that they use with their very difficult to treat patients. The typical protocol, what we call the typical protocol, is 36 sessions over 36 days. So 5 days a week, almost 6 weeks of treatment. The accelerated protocol that we're using here is 6 days. Over those 6 days, people are getting 5 hours of treatment each of those days. There's some additional treatments that are delivered over the next 4 weeks, but the heavy lifting is done with those 6 days, 5 treatments each day. You get 10 minutes of stimulation, 50-minute rest, 10 minutes of stimulation, 50-minute rest, so 5 hours. And the benefits of that are comparable to what we get with a standard protocol over 36 days.
6 days, is that done in a row?
It can be done in a row. So we'll typically do, Monday through Friday and then another Monday. Gotcha. You can break it up and do, 3 days, 1 week, 3 days, another week, or some combination thereof to get the 6 treatments in 2 weeks period of time, depending on people's
as fast as possible.
Yeah.
Are you seeing the same results as you would doing 36 over 36?
We are. Brainsway, the manufacturer of our device, the studies that they've done is, in this difficult to treat population, 80% of people are showing a robust response.
post the accelerated treatment, there's 4 weeks left in the treatments. What does that time look like? What does the treatment plan for somebody look like during that?
So Brainsway, our manufacturer, what they recommend are the 6 sessions. Over the next 4 weeks, you come in for 2 sessions each week. So you'll come in for a day, get a session, 50-minute rest, another session, and that's repeated, over 4 weeks after the initial 6 days.
So 6 sessions, right? 6 days. And then the 4 weeks, is that 1 session a week or 1 day a week?
2 sessions.
2 sessions.
Over 1 day, over 4 weeks. If that makes sense.
Got you.
Yeah.
Okay. So it's a remaining 8 sessions.
Yeah, exactly.
Okay.